Welcome to the deep dive. We sift through stacks of information, pulling out the key insights just for you, our listener. Today we're getting into something really personal, but honestly something that often just happens without us even noticing. Maybe you're trying to figure out your body's rhythms, maybe you're trying to conceive, or maybe you're just curious about, well, what's really going on with the whole menstrual cycle thing? We're going to explore the hidden language of your body, focusing on one amazing event: ovulation.
It's really quite extraordinary, isn't it? Just understanding this one biological event can tell us so much about our overall health and well-being. Ovulation itself, it's a scientific marvel, really. It's central to reproductive health. And figuring out how it works, whether you want to get pregnant or just know your body better, it's incredibly empowering.
Absolutely. And that's what this deep dive is all about. We take all sorts of sources, medical reviews, personal stories, you name it, and boil it down for you. We want to give you a shortcut to being well-informed, maybe some surprising facts, definitely some actionable insights, and hopefully keep it interesting, without making your head spin. So let's get started on this. Right, ovulation. It's a word we hear a lot. But what exactly is happening inside when an egg gets released? It feels like more than just pop, out comes an egg. It sounds like this perfectly timed micro-event happening month after month for so many people. Can you break down the basics for us?
Yes, certainly. And you're right, it speaks to the incredible efficiency and precision of the female reproductive system, especially when you consider how short-lived the egg itself is. So fundamentally, ovulation is that biological process where your body releases a mature egg from one of your ovaries, typically just one egg, usually right around the middle of your menstrual cycle. Now, the journey of that egg is key. Once it's released, it doesn't just drift. It's quickly swept up into one of the fallopian tubes. And that moment, as it travels down the tube, that's the crucial window. That's when it could meet sperm and get fertilized. If fertilization happens, great. The fertilized egg, now a zygote, keeps moving towards the uterus, aiming to implant. That implantation is what starts a pregnancy. But, and this is critical, if that window, just 12 to 24 hours, passes without fertilization, the egg simply degenerates. It doesn't, get flushed out with your period. Your body just reabsorbs it very efficiently. And then the uterine lining, which had been getting all ready for a potential baby, well, it gets shed during your next period. Cycle ends, cycle begins again.
Wow, 12 to 24 hours for the egg. That seems incredibly tight. But okay, here's where it gets really interesting, isn't it? It's not just about that one day the egg is viable. There's this wider window for conception, and it's all down to the staying power of sperm. What exactly is this fertile window? And why is it so much longer than the egg's lifespan?
That's a really excellent point. Understanding this timing is, well, it's absolutely key for anyone trying to conceive. Strategic timing, you could call it. The fertile window isn't just ovulation day. No, it actually stretches for about 5 days before ovulation, includes the day of ovulation itself, and sometimes maybe even the day after. And the reason it's so much longer than the egg's short 12 to 24-hour life, exactly what you said, the remarkable survival skills of sperm. Sperm can stay alive and kicking, ready to fertilize, inside the female reproductive tract for typically 3 to 5 days, sometimes even longer in the right conditions, maybe up to 7 days. So yeah, your best chance of getting pregnant actually happens when live, healthy sperm are already there, waiting in the fallopian tubes right when the egg arrives. Think of it like having the welcoming committee ready and waiting. Let's make that concrete. Say you have an average 28-day cycle, maybe you ovulate around day 14. That fertile window could realistically start as early as day 9. So having sex on days leading up to ovulation, say day 9, day 11, day 13, that can often be much more effective than just focusing only on day 14. You're basically ensuring there's a supply of sperm waiting for the egg's grand entrance. It's all about maximizing the odds.
So, the big picture here. It feels like understanding ovulation isn't just about baby-making logistics. It's more about connecting with your body's, incredible internal clockwork. You might think tracking ovulation is only for people trying to get pregnant, but the sources we looked at suggest there are wider benefits, maybe ones people don't always think about.
Exactly, and that's what's so profound. Tracking ovulation shifts from being just a fertility tool to becoming really a powerful form of biological self-awareness. It can give you early warnings, a deeper sense of bodily autonomy, regardless of whether pregnancy is the goal right now. Sasha Hackman in Obgyn put it really well. She said, even if you're not actively trying to conceive, being aware of your menstrual cycle and ovulation patterns provides great insight into your reproductive health. That awareness, it's like a key. It helps you tune into your body, notice those subtle hormonal shifts, maybe identify patterns in your health you'd otherwise miss. For example, if you consistently notice signs that you're not ovulating, that's called an ovulation, it could be a flag for something like polycystic ovary syndrome, PCOS, which has health effects way beyond fertility. Some people also use this fertility awareness as a natural family planning method. Now, it takes serious dedication and accuracy, but it highlights that understanding your body can be a form of non-hormonal control too. The core idea is that knowing your ovulatory patterns helps decode your overall physiological well-being. It's a window into your health, far beyond just making babies.
Right. Now, here's one you might have heard kicking around. It sounds almost, well, too good to be true, maybe. The idea that you can ovulate twice in 1 month. It's a tempting thought, isn't it? But it turns out it's actually a pretty common myth. Let's clear this one up.
Yes, let's. That's a really crucial point because, scientific information can get twisted easily. It's vital to understand what ovulation truly means. So let's be crystal clear. It is not biologically possible to ovulate twice within a single menstrual cycle. Typically, only one egg gets released during one distinct ovulation event, full stop. The confusion about ovulating twice a month usually comes from mixing up calendar months, 30 or 31 days, with menstrual cycle length, which averages around 28 days, sometimes less. So theoretically, if you have a very short cycle, say 26 days, you could ovulate very early in a calendar month, like January 2nd, and then again very late in that same calendar month, maybe January 28th. But see, that's still only one ovulation per menstrual cycle. It's not 2 ovulations in one cycle. And we need to separate that from something called hyperovulation. That's different. Hyperovulation is when more than one egg is released at the same time or very close together during a single ovulatory event, maybe 2 eggs from one ovary or one from each within that 24-hour window. And that increases the chances of having fraternal twins if both eggs get fertilized. But it's still one single ovulation event. There was a definitive study back in July 2003 in the Journal of Fertility and Sterility. They looked specifically at follicular development, and while they saw things they called multiple follicular waves, meaning some follicles started developing but didn't quite make it, they found absolutely no evidence of women ovulating more than once per cycle. So yeah, that research really debunked the whole double ovulation idea. Your body is remarkably precise, usually releasing just 1 egg per cycle.
Okay, so let's zoom out a bit and think about the entire menstrual cycle. It's not just a period and then ovulation. It's more like a sophisticated multi-act play, right? Each phase sets the stage perfectly for the next one. It's this incredible biological rhythm that usually starts around puberty. Hormones are basically conducting this orchestra every month, preparing the uterus for a potential pregnancy. And while we say 28 days is average, the normal range is pretty wide. Anything from 21 to 35 days is considered normal, and it includes the period, the egg maturing, and that key moment, ovulation.
That's a great way to put it, a multi-act play. Because what's truly fascinating is how the whole system works together, in concert. Specific organs, specific roles, all aiming for the same goal each month. Let's quickly list the main players in this orchestration. You've got the ovaries, of course. Amazingly, they hold all the eggs you'll ever have right from birth, maybe around 1 million, though only about 400 or so will actually get released during your fertile years. These eggs are stored in little sacs called follicles. Yeah. When an egg is released, it travels through the fallopian tubes. That's usually where fertilization happens. Then there's the uterus, the incredible organ where a fertilized egg implants and, where a baby grows, and obviously the cervix, the vagina, even the breasts. They all play important supporting roles in the cycle and potential pregnancy. And it's worth mentioning the body's efficiency again. Those unreleased eggs, or eggs that don't get fertilized, they're just reabsorbed. No waste. It's a continuous, self-regulating process.
Okay, so Act 1, menstruation. Often just called your period. We tend to think of it as the end, but you're saying it's actually a powerful beginning, kicking off the next cycle. Officially, it's cycle day 1, CD1. When the bleeding starts, the body's basically cleaning house, releasing the unfertilized egg from last cycle and shedding that thickened uterine lining.
Exactly, and that distinction is crucial. It brings up an important point. How do you know if it's a real period versus other kinds of bleeding, especially if you're trying to understand your body's natural rhythm? During menstruation itself, the levels of both key hormones, estrogen and progesterone, are at their lowest. That hormonal dip is the signal for the uterine lining, which built up in the previous cycle, to break down and shed. Now, everyone's experience is different, right? Periods can last anywhere from 2 to 7 days. Flow can be light, heavy, somewhere in between. That's all normal variation. But the key is this bleeding is a true menstrual period, directly linked to your body's natural ovulation cycle. That's fundamentally different from, say, the withdrawal bleed you might get if you're on hormonal birth control pills. With most pills, ovulation is suppressed. So the bleeding you get during the placebo week isn't driven by your natural cycle. It's a reaction to withdrawing the synthetic hormones. Understanding that difference is really important, especially if you're using fertility awareness methods or trying to track your natural cycle for conception.
Got it. So, period is done, lining shed. Now we enter what you call the follicular phase. This sounds like the body's prep time, getting everything meticulously ready for the main event, ovulation. It starts on day 1 of the period, and it's all about preparing the uterus and maturing the eggs. And you mentioned this phase is often responsible for why cycles vary in length, like a shorter follicular phase means a shorter cycle overall.
Precisely. It's the most variable part of the cycle in terms of length. And yes, think of it as an intricate feedback loop, mainly between the brain and the ovaries, making sure the uterine environment is perfectly primed for a potential embryo. It starts up in the brain, in the hypothalamus. It starts producing gonadotropin-releasing hormone, GnRH. Levels slowly climb. This GnRH then signals the pituitary gland, another small gland nearby, to start making follicle-stimulating hormone, or FSH. FSH is like the messenger. It travels to your ovaries and basically tells the immature eggs, which are inside their little protective sacs called follicles, to start ripening. Usually in a healthy cycle, one follicle kind of outpaces the others and becomes the dominant follicle. That's the one that's likely going to release the egg this cycle. This whole prep phase can last until about day 13 in a typical 28-day cycle, but again, it varies. Now, as these follicles grow, FSH also tells the ovaries to produce a lot of estrogen. Estrogen is super important here. It does a couple of key things. First, it signals the cells in the endometrium, the uterine lining, to grow rapidly. The lining gets thicker, spongier, more blood vessels develop, all preparing a welcoming bed for a potential pregnancy. At the same time, rising estrogen causes that amazing transformation in cervical mucus we talked about. It becomes thinner, clearer, more slippery, creating that perfect sperm superhighway through the cervix.
Okay, what an incredible buildup. And then, boom, ovulation, the main event, the bullseye of the cycle, you call it. The moment the egg is finally ready for its journey. You said it typically happens about 14 days before the next period starts, which puts it around day 14 in that classic 28-day cycle. What's the specific hormonal switch that flips to make this happen?
That's it, the climax. And its precision, driven by this powerful hormonal signal, makes it such a reliable marker for tracking. The absolute key trigger for ovulation is a sharp, dramatic rise. We call it a surge in luteinizing hormone, or LH. This LH surge isn't random. It's a direct response to those high estrogen levels that built up during the follicular phase. High estrogen basically tells the pituitary, okay, an egg is ready. Then, about 36 hours after that LH surge kicks off, the mature egg finally breaks free from its dominant follicle on the ovary surface. Almost instantly, these little finger-like things at the end of the fallopian tube, called fimbriae, sweep the egg inside. Once it's in the fallopian tube, it's perfectly positioned to potentially meet sperm. And let's hammer home the timing for conception again. The egg itself, only viable for about 12 to 24 hours. Super short window. But sperm, much tougher. They can hang around for up to 5 days, sometimes even more, inside the reproductive tract, which means biologically having sex in the days leading up to ovulation is often more effective than waiting for the actual day. Get the sperm there before the egg arrives. That really maximizes the chance of fertilization.
It sounds like after that big release, the body totally shifts gears. It goes from get ready to wait and see, preparing for one of two paths. So what does this all mean for the next phase, the luteal phase? You called it a masterclass in adaptability.
It absolutely is. And yes, that's why it's often called the 2-week wait. There's this period of intense hormonal activity, getting the body ready for either a new life or a reset. So right after ovulation, the levels of FSH and LH, which were driving things before, they drop off significantly. The empty follicle on the ovary, the one that just released the egg, it doesn't just vanish. It transforms into something called the corpus luteum. That literally means yellow body because of its color. This corpus luteum is temporary, but it's critical. It becomes a little progesterone factory. Progesterone is the star hormone of this luteal phase. It continues prepping the uterine lining, making it even thicker, richer with blood supply, and it secretes special nutrients. It's creating the perfect, cozy nest for a fertilized egg. Now, if an embryo does implant, the corpus luteum gets a signal to keep making progesterone. Levels stay high, maybe even rise, maintaining that lining for the early pregnancy. Estrogen levels, which peaked right before ovulation, they drop right after, then usually rise a bit again mid-luteal phase before falling just before menstruation if there's no pregnancy. Okay, if an egg is fertilized and the developing embryo implants, usually about a week after conception, the body starts producing a brand new hormone, human chorionic gonadotropin, or HCG. HCG is vital. It's the signal that tells the corpus luteum, hey, keep pumping out progesterone, we need this lining. HCG is also the hormone that home pregnancy tests detect. That's why you can often get a positive test about a week or so after implantation. And this is often when early pregnancy symptoms like sore breasts kick in, thanks to all that progesterone and estrogen. But if no conception happens, the egg degenerates, gets reabsorbed. Progesterone and estrogen levels start to fall in the last few days of the cycle. Blood vessels in the uterine lining constrict, cutting off supply. The lining breaks down. Then, chemicals called prostaglandins cause the uterine muscles to contract. Hello, menstrual cramps. And finally, blood and tissue are shed. Your period starts, and the whole beautiful cycle begins again. It really is amazing cyclical wisdom.
Right. It's incredible how the body sends out all these signals, isn't it? Some are really subtle, maybe you wouldn't even notice, but others can be pretty clear. The trick, I guess, is learning to actually listen and interpret them. While ovulation can be totally silent for some people, others get a whole range of physical, even emotional symptoms.
And it's so important to remember, you're probably not going to feel all of these things at once. And just because you don't feel anything doesn't mean you're not ovulating. Courtney Murch, an OB-GYN director, had some good advice here. She said basically, yeah, there are signs to help you track, but don't add stress to your journey. It's about observation, not obsession. She also pointed out very sensibly that if your cycles are consistently unpredictable, that's when you should see a provider. It could signal something deeper going on. The goal is just to get more in tune with your own unique body.
Okay, let's talk about a classic tracking method. This one's been around for a while and for good reason. It's a tiny shift in your body, but if you're paying attention, it tells a big story. Basal body temperature or BBT?
Yes, BBT. What's really insightful here is how it works. It's that hormonal shift after ovulation, specifically the rise in progesterone, that causes this subtle but consistent increase in your core body temperature. That's what makes it measurable. So BBT is your lowest body temperature when you're fully at rest. Ideally, you take it first thing in the morning before you even sit up, talk, drink, anything. The key sign you're looking for is this. On the day after ovulation, your BBT will typically jump up slightly, maybe half a degree to a full degree Fahrenheit, and then it stays elevated until your next period starts. Some women even notice a slight dip in temperature just before that rise, which can make the pattern even clearer. Now, the American College of Obstetrics and Gynecologists, ACOG, makes an important point. Charting BBT is great for confirming that ovulation already happened, but it does not predict it ahead of time, which means your most fertile time, those crucial 2 or 3 days leading up to and including ovulation day, happens before you see that temperature spike. So to use this effectively, you need a special basal thermometer. They're more sensitive than regular fever thermometers. And you need to track consistently every single morning for several months to really learn your body's individual pattern. It definitely takes diligence, but the information it gives you looking back, confirming ovulation, is incredibly valuable for understanding your cycle.
Okay, so BBT tells us what just happened, but to actually predict ovulation, you mentioned the body creates its own sperm superhighway. That's the cervical mucus changes, right? This sounds like a really powerful real-time indicator.
It really is one of the most powerful and frankly accessible biological signs you can track, because the consistency of your cervical mucus directly reflects your hormonal state, particularly estrogen levels. It's designed to help sperm survive and travel. It's just a beautifully adapted mechanism. So cervical mucus is essentially the vaginal discharge you might notice. In the days leading up to, during, and right after ovulation, you'll likely see more of it, and crucially, its texture changes dramatically. The American Society for Reproductive Medicine, ASRM, notes that the amount usually increases starting 5 or 6 days before ovulation, peaking maybe 2 or 3 days before. And it transforms into this clear, thin, slippery, stretchy consistency, often compared to raw egg whites. We call it EWCM, egg white cervical mucus. This EWCM is vital because it creates the perfect medium for sperm. It helps them swim easily through the cervix, keeps them alive longer, protects them. Your chances of conception are highest when you have this clear, slippery mucus. How do you check it? You can wipe with toilet paper before you pee, insert a clean finger towards your cervix, or just notice what's in your underwear. The key is feeling the consistency. Rub it, stretch it between your thumb and finger. And a practical tip, wait maybe 12 to 14 hours after sex before checking, because semen can sometimes look similar and confuse things. Let's quickly recap the stages from least to most fertile, because that progression is key. Dry, sticky. Right after your period, things might be dry. Then maybe some cloudy, sticky stuff. Thick, paste-like, hard for sperm to navigate, least fertile. Creamy. Next, maybe creamy, lotion-like mucus. Pearly white or yellowish. Still restricts sperm quite a bit, considered non-fertile. Watery, getting closer. Mucus becomes clearer, watery, thinner, slippery. ACOG points this out. Sperm can move more freely now, but it's not peak fertility yet, egg white, EWCM, the gold standard. Clear, thin, super slippery, stretches an inch or more without breaking. This is peak fertility, ideal for sperm. You might notice a lot more of it now, maybe 30 times more. The March of Dimes says seeing this increase 2 days running is a great sign to try for pregnancy. Post-ovulation. After ovulation, progesterone takes over and mucus usually gets thick, cloudy, sticky again, less abundant. Kind of closes the gate. Oh, and remember, lots of things can affect your mucus. Illness, medications like antihistamines or hormonal birth control, hygiene products, douching, which isn't recommended anyway, sex, stress, breastfeeding, even lubricants. And if you ever notice really concerning changes like yellow, gray, or green color, a strong fishy smell, burning, itching, definitely call your provider. Always listen to your body.
Okay, beyond the big two, BVT and cervical mucus, the body has these other, maybe quieter ways of signaling, like little internal notifications, you said. Though for some people, they're maybe not so quiet. What else might women feel around ovulation time?
It's fascinating, isn't it? It really shows how differently we all experience these internal shifts. Our bodies just communicate in unique ways. So besides BVT and mucus, some women can actually feel subtle changes in their cervix itself. Around ovulation, it tends to get softer, sits higher up, feels wetter, and the opening might feel slightly more open. You'd need to check regularly with a clean finger throughout your cycle to notice the difference, establish your baseline. Some also report their vulva, the outer lips, feeling a bit swollen or more sensitive. Then there's cramping, often called Mittelschmerz, that's German for middle pain. It can feel like mild discomfort, maybe little twinges in the lower abdomen. Often it's felt just on one side, the side of the ovary releasing the egg that month. Less often, it might show up as low back pain or just general side pain. We heard quite a range of experiences from community members on this. Some said a dull, crampy feeling. Others reported bad pain, intense ache. One even ended up in the hospital once, though that's rare. Others said it was not even noticeable or managed it with a heating pad. Ugh, it really runs the gamut. But it's important to stress that severe, debilitating pain is unusual. Mittelschmerz usually doesn't stop you from going about your day. If it is severe, that's worth checking out. Also, some women experience light spotting, maybe brownish discharge right around ovulation. That's from the follicle rupturing to release the egg. It can be red or brown, last a few hours or a couple of days. Breast tenderness is another common one. After ovulation, progesterone surges, and breasts can feel tender, heavy, achy, nipples might get sore, similar to PMS symptoms for many. And finally, fluid retention or bloating. Those hormone surges, LH and estrogen, can cause temporary water retention. Plus, progesterone can slow digestion a bit, maybe cause some gas. Usually only lasts a few days, though.
Wow. So it's really a whole body thing, isn't it? Hormones affecting not just the obvious parts, but senses, mood, everything. Beyond those more physical signs, there are some less reliable, but still quite intriguing potential signals of ovulation too.
Absolutely, and it's fascinating how biology might be nudging us in certain ways. For instance, some research suggests women might have a heightened sense of smell or taste around ovulation or in the latter half of their cycle. Now, the studies on this are a bit mixed. It's not a definitive sign for everyone, but it's an interesting potential hormonal influence on our senses. A more widely reported and biologically logical sign is an increased sex drive, or libido. Many women just anecdotally report feeling, well, sexier, more flirty, sociable, more attractive right before and during ovulation. And studies actually back this up, linking increased libido to that surge in luteinizing hormone, LH. This heightened desire might last about 6 days, starting maybe 3 days before the LH peak. From an evolutionary standpoint, it makes perfect sense, right? Increased drive during peak fertility boosts the chances of conception. And then there are potential changes in appetite or mood. Some researchers found appetite might actually decrease slightly when estrogen peaks just before ovulation, almost like the body's prioritizing reproduction over food. But after ovulation, when progesterone rises to prep for pregnancy, appetite might increase. Some studies showed women eating 90 to 500 extra calories a day during that luteal phase. And mood. We all know about PMS moods, but there's evidence suggesting a more positive mood around mid-cycle near ovulation may be linked to those FSH and LH hormones from the pituitary. Like that community member said, definite mood changes alongside cramping. It really underscores how interconnected everything is: physical, sensory, emotional, all tied to these hormonal rhythms.
Okay, we've covered the signals your body sends. Now let's talk practical tracking methods, the tools that can help you pinpoint that fertile window more precisely. Think of these as different tools in your personal fertility detective kit. Each one gives you a piece of the puzzle. And while no single method is perfect, combining them can really boost your chances of figuring out when ovulation is most likely, so you can time things accordingly, whether that's intercourse
or IUI.
That's the key takeaway. Combining methods usually gives the clearest picture. Let's revisit basal body temperature, BBT charting first, from a practical tool perspective. As we said, it won't tell you beforehand when to have sex, but it's invaluable for understanding your cycle after the fact. It confirms ovulation happened, which is a vital information for diagnosis or just pattern recognition over time. So the method is: track your temp daily with a basal thermometer first thing upon waking. Look for that sustained rise of 0.5 to 1 degree Fahrenheit. That rise tells you ovulation already occurred. The temp stays high until your period. The big pro: it confirms ovulation. You get real evidence an egg was released. The main con: it's retrospective. By the time you see the rise, your most fertile days leading up to it are already gone. So not great for timing sex in the moment, but excellent for understanding past cycles. You need consistency track for several months to see your pattern, factoring in things like poor sleep or sickness that can mess with temps. It's cheap after you buy the thermometer, but yeah, it needs discipline. If your temp rises on day 15, you likely ovulated day 14, making days 9-14 your fertile window. Knowing that retrospectively is powerful.
Right. And then there's the body's built-in guide, that cervical mucus. You said monitoring that is a really effective way to predict ovulation, giving you a heads up.
Exactly, because those mucus changes are directly driven by hormones, especially estrogen. They provide a direct, observable clue about your fertile window, often days in advance. It's incredibly powerful for fertility awareness. The amount, color, consistency, it all changes predictably. Remember how to check. Wipe before peeing, use a clean finger, or observe your underwear. Feeling the consistency rubbing, stretching is key. And wait 12-14 hours after sex. Let's quickly revisit why the stages matter. Dry, sticky, obstructive, hard for sperm, least fertile, creamy. Less obstructive, but still not ideal, non-fertile. Body's warming up, watery, getting fertile. Thinner, slipperier, sperm move better. Egg white, EWCM, peak fertility. Clear, thin, super stretchy, perfect for sperm survival and travel, lots of it. Seeing this for 2 days, good time to try. Post-ovulation, thick, cloudy, sticky again. Progesterone effect closes the gate. And just a reminder, factors like health, meds, hygiene products, sex, stress, breastfeeding, surgery, lubricants can all affect CM. Always check with your doctor if you see weird changes like odd colors, smells, or irritation.
Okay, moving beyond the body's own signals. For those who like a bit more tech, maybe more data, to make tracking easier and get a clearer prediction, there are tools like ovulation predictor kits, OPKs, and fertility monitors.
Yes, and it's fascinating how the monitors especially can pull together different data points for a more complete, often more precise, picture of your specific cycle. Let's start with ovulation predictor kits, OPKs. These are usually urine test strips you can get easily. They work mainly by detecting that luteinizing hormone, LH surge we talked about, the one that happens 24 to 36 hours before ovulation. So they give you a valuable heads up, a predictive window to plan intercourse, or IUI. Testing around the same time each day is usually recommended. Most are urine tests, some are saliva-based. They offer prediction, which is great, but they don't work perfectly for everyone. Some women have LH surges that are too short or too low for standard tests, or maybe multiple small surges before the real one. Then you have fertility monitors. These are generally more sophisticated. They often integrate several methods. Many track BBT automatically, prompt you to log cervical mucus, and analyze urine tests using their own test strips like built-in OPKs. By combining these inputs, they identify your most fertile and least fertile days on a chart. They might tell you when to do urine tests, let you log periods, sex, etc. Some are apps linked to sensors, others are dedicated digital devices. The big advantage is that synthesis of information, it can make tracking less of a chore and potentially more accurate by looking at multiple signs. Great for data lovers.
Okay, from high-tech back to basics. The calendar method, or standard days method. Sounds simple, maybe the oldest trick in the book. But you mentioned it comes with some pretty big warnings.
Right, and that really highlights the issue with applying one-size-fits-all rules to biology, which is so variable. The calendar method is simple, yes, and it works best if you have very regular cycles, like always the same number of days long, month after month. How it works: you figure out your typical cycle length. Then you estimate ovulation day by counting back 14 days from when you expect your next period to start. Your fertile window is then that estimated ovulation day plus the 5 days right before it. So if you have a perfect 28-day cycle, period starts day 1, next period due day 29. Count back 14 from day 25 gives you day 15 as ovulation. Count back 14 from day 28, day before next period. That's day 14 ovulation. Fertile window, days 9 through 14. And remember, you're most fertile in the last 3 days of that window because sperm live longer than the egg. The pro: it's easy, it's free. Just need a calendar. The big con. It assumes ovulation always happens exactly 14 days before your period. That's just not true for everyone. The follicular phase length varies. Plus, predicting when your next period will start can be tricky if you're not perfectly regular. So, okay, as a rough estimate, but for accuracy, usually needs to be combined with other methods like checking mucus or BBT.
Right? Usually our bodies follow this amazing rhythm, but sometimes things get offbeat. And when the usual script doesn't happen, it can definitely cause worry or confusion. Let's talk about irregular periods and something called anovulation.
This is a really critical area, especially if conception is the goal, because here's the kicker. Just because you have a period doesn't automatically mean you ovulated. That's a key distinction. An irregular period just means the time between periods changes a lot from cycle to cycle, an occasional odd cycle. Usually fine, maybe stress or travel, but consistently irregular periods. That can signal underlying issues worth looking into. Anovulation specifically means a cycle where no egg is released at all. And obviously, if no egg is released, pregnancy is impossible that cycle. Let's clarify some terms doctors use. Amenorrhea means no period at all. Primary amenorrhea is when a girl hasn't started her period by age 15. Secondary amenorrhea is when someone who used to have periods stops having them for 3 months if they were regular, or 6 months if they were irregular. Then there's oligomenorrhea. That means infrequent periods, typically fewer than 6 or 8 periods a year. Long, unpredictable cycles. Knowing these helps understand when irregularity might be more significant.
It's really striking how sensitive our bodies are, isn't it? Like fine-tuned instruments. And how many everyday things can throw that delicate balance off kilter? Let's talk about common, non-medical reasons for missed or late periods, things that aren't necessarily serious diseases, but more like the body responding to life.
It's a great point. Connecting it to the bigger picture, these irregularities are often the body's way of saying, hey, something's out of whack here. They shouldn't just be brushed off. Fundamentally, any missed or late period comes down to hormones fluctuating or being out of balance. Progesterone, estrogen, FSH, LH, prolactin, the whole gang. So, common, non-medical culprits. Pregnancy, obvious first one. A missed period is often the earliest sign. Once implantation happens, HCG production starts, preventing menstruation. Stress, huge factor. Big life events, chronic stress, even things like changing work shifts or travel. They can all mess with the brain signals to the ovaries, potentially delaying or stopping ovulation temporarily. Breastfeeding. Prolactin, the milk-making hormone, naturally suppresses ovulation. Makes sense biologically, but using it as birth control is risky because you usually ovulate before your first postpartum period returns. You could get pregnant without realizing your cycle is back. Medications, lots can affect cycles. Hormonal birth control is designed to stop ovulation. The bleed on placebo pills isn't a real period. Shots, hormonal IUDs can also stop or delay periods. Some psychiatric meds, chemo drugs can also interfere. Weight extremes, body fat is key for hormone production. Being very underweight, BMI below 18.5, can shut down estrogen production, slow GnRH release. The body basically says not enough energy for reproduction right now, focus on survival. It's a major health warning. Obesity can lead to too much estrogen production from fat cells. This excess also disrupts the hormonal balance needed for ovulation, causing irregular or absent periods. Also linked to insulin resistance, another health flag. Perimenopause, the natural transition towards menopause, starts maybe mid-30s, more common in 40s. Estrogen levels fluctuate wildly, causing cycles to become irregular, longer, shorter, skipped altogether. Early menopause before 40 is called primary ovarian insufficiency, has long-term health implications too. All these really show how interconnected our lifestyle and internal state are.
That's a really clear picture of how life impacts cycles. But it's also kind of amazing how many medical conditions, things you wouldn't necessarily connect, can show up as menstrual irregularities. Your cycle really is telling a story about your overall health. What are some specific medical conditions that can cause these issues?
Exactly. This really highlights the systemic nature of reproductive health. Hormonal balance isn't isolated, it's tied into so many other body systems. Polycystic ovary syndrome, PCOS, very common, affects maybe 1 in 10 women with irregular periods. Ovaries produce too many androgens, male hormones, which stops eggs from maturing and releasing properly, leads to infrequent or no ovulation, often linked with insulin resistance, risk of diabetes, plus symptoms like excess hair, acne, weight issues. Thyroid problems. Both underactive hypothyroidism and overactive hyperthyroidism, thyroids can wreak havoc on hormone balance and cause irregular or missed periods. The thyroid is a master regulator. Pituitary tumors, rare but sometimes benign tumors on the pituitary gland secrete too much prolactin. High prolactin suppresses ovulation, leading to missed periods. Pelvic inflammatory disease, PID, a bacterial infection often from untreated STIs, causes inflammation, scarring, can lead to painful, irregular periods, plus other symptoms like pelvic pain, pain with sex, burning urination, fever, needs antibiotics fast, endometriosis. Uterine lining-like tissue grows outside the uterus, ovaries, tubes, etc. Response to hormones causes inflammation, pain, can mean painful heavy periods or brownish spotting between periods. Also pain with bowel movements, urination, sex, and infertility. Chronic diseases. Less common but uncontrolled conditions like diabetes or celiac disease can sometimes affect menstrual regularity through hormonal or nutritional pathways. It really shows how your reproductive health is often a mirror of your general health.
Given all that, it really drives home the idea that your cycle is a vital sign. So what does this mean for you listening? Knowing when to get expert advice is just key for staying on top of your health. While a one-off weird cycle is usually okay, persistent changes definitely need a conversation with your doctor.
That's the crucial takeaway message. Not having periods for a long time or having them very infrequently isn't just an inconvenience. It can signal a health problem that could lead to more serious long-term issues if ignored. There are specific red flags that mean time to call the doctor. Missing periods for 3 months straight or more. Having fewer than 9 periods in a whole year. If your periods used to be regular and suddenly become consistently irregular, if your periods regularly last longer than 10 days, if your cycles are consistently longer than 35 days apart, remember 21-35 is typical range. And why does it matter? Untreated irregularities can contribute to problems like cardiovascular disease, diabetes, infertility, even osteoporosis from low estrogen over time. So practical advice. If your period's just a few days late, take a pregnancy test first. If it's negative and you're still worried, or if you hit any of those red flags we just listed, absolutely consult your healthcare provider. Tracking your cycle, even just on a simple calendar or app, gives your doctor really valuable information. Don't hesitate to advocate for yourself.
Okay, let's switch gears slightly and talk about something specific that can cause alarm. Brown discharge. It's one of those things that can definitely make you pause and think, uh-oh, what's this? But thankfully, a lot of the time, it's just your body doing its normal thing.
You're right, it can look alarming, but let's demystify it. Fundamentally, brown discharge is just old blood mixed with normal vaginal fluid. The brown color is the key. It means the blood has oxidized. It's not fresh red blood. So while seeing it might make you worry, the vast majority of the time it's completely harmless. It's a normal physiological thing stemming from common, non-scary reasons.
Okay, so when is it usually harmless? What are those normal situations where brown discharge is just part of the process and you can probably relax about it?
It's fascinating, actually, how many different normal body events can lead to brown discharge. That's why it's usually not an immediate panic situation. Let's run through the common benign causes. Beginning or end of period. Probably the most common reason. Seeing brown or light brown discharge for a few days right at the start or tail end of your period is super normal. It's just older blood taking its time exiting because the flow is lighter then. Hormonal contraception. Spotting, often brownish, can happen with birth control, especially when starting it. More common with progestin-only mini pills. If estrogen levels are low, the lining might shed a bit between periods and slow exit equals brown color. Recent sex. Sometimes vigorous sex or deep penetration can cause tiny tears or bruising in the vagina or cervix, especially if lubrication isn't great. Leads to light brown blood-tinged discharge afterwards, usually temporary. Pap smear pelvic exam. Very common to have light red or brown spotting after a pap test, where cells are gently scraped from the cervix. A regular pelvic exam is less likely unless maybe you're pregnant and the cervix is more sensitive. Implantation bleeding. This is the one people trying to conceive often wonder about. Light spotting or brownish discharge about a week before your period is due could be an early pregnancy sign. Thought to be the embryo burrowing into the lining 6-12 days after conception. Usually very light, short-lived. Not everyone gets it. Around ovulation, we mentioned this earlier, some women get a bit of spotting or brownish discharge mid-cycle when the egg releases from the follicle. Can be red or brown, might last a few days. During pregnancy. Actually, light brown discharge is very common in pregnancy. The cervix is extra sensitive and has more blood vessels then, so minor bleeding after sex or an exam is common. Late in pregnancy, bloody show. Mucus mixed with brown red blood can mean labor is near. So yeah, lots of normal reasons. Often just means old blood making a slow exit.
That's definitely reassuring to know all those common causes. But of course, like any symptom, sometimes brown discharge can be a sign that something more serious needs attention. When should we look closer and maybe treat it as a potential red flag?
That's the crucial distinction, isn't it? Knowing when it's just normal variation versus when it's a signal that needs a doctor's input. It's about listening to the whole story your body is telling, especially if other symptoms come along. Perimenopause. As we mentioned, persistent or irregular brown spotting can be part of the hormonal fluctuations of perimenopause or even primary ovarian insufficiency, early menopause. Something stuck, if the brown discharge has a really foul odor, it could mean a forgotten tampon, condom piece, etc. is causing an infection. If you can't remove it yourself or symptoms continue, see a doctor ASAP. Pelvic inflammatory disease, PID. In some cases, brown discharge, especially with an unusual smell, could be PID. Look for other signs like lower abdominal pain, pain with sex, burning urination, fever, needs antibiotics, sexually transmitted infection, STI. Things like chlamydia or gonorrhea can cause spotting, which might look brown, and discharge, often with painful urination, pain during sex, pelvic pressure, needs testing and treatment. Ovarian cyst. While many cysts are harmless, a large or ruptured one can sometimes cause brown discharge, plus abdominal pain, may be sharp, pelvic pressure, pain during sex or urination. Endometriosis can cause chronic brownish spotting between periods, along with painful heavy periods, pain during bowel movements, urination, sex, and fertility issues. Polycystic ovary syndrome, PCOS. The irregular hormonal environment can lead to light bleeding or brown discharge, alongside the other PCOS symptoms like excess hair, acne, weight gain. Cervical cancer. Extremely rare, but important to mention, signs can include persistent spotting between periods or after sex, heavier longer periods, increased discharge, watery, bloody, smelly. Any persistent, unexplained bleeding needs checking, even though this cause is rare. Knowing these possibilities just helps you know when not to ignore persistent or accompanied symptoms.
Absolute vital distinction. So bottom line for our listeners.
Yeah.
When in doubt, trust your gut and talk to a professional. Most brown discharge is harmless, but there are definitely times when making that call is the right move.
Exactly. Your health and peace of mind come first. While a single episode might be nothing, certain patterns or accompanying symptoms definitely warrant a call to your provider. Call them if. The brown discharge goes on for more than a couple of weeks, especially if it's new for you. It happens frequently right after sex. You have itching, burning, or discomfort down there along with it. The discharge develops a strange, strong, or fishy odor. You have new or worsening cramps or pelvic pain at the same time. And importantly, if you are postmenopause and have any new spotting or discharge, that always needs to be checked out. These things can be clues that something more is going on. Getting it checked is always the safest, most informed approach.
All right, let's shift focus now to optimizing chances for those who are trying to conceive. It's such a significant journey for many, and it really starts before you even try, doesn't it? It's about laying that strong foundation, giving both partners' bodies the best possible start. While conception timing varies wildly, there are steps you can take beforehand to potentially speed things up and aim for a healthier pregnancy.
You're absolutely right. Proactive prep can make a real difference. That REI physician, Tarun Jain, strongly advised getting your OB-GYN involved early. That echoes the key first steps. Preconception checkup. See your OB/GYN or midwife before you start trying. They can review your health, discuss risks, give personalized advice. It's invaluable. Kick unhealthy habits. This is huge for both partners. Stop smoking, cigarettes, marijuana. Cut back significantly or stop drinking alcohol. Avoid recreational drugs. These impact fertility and pregnancy health. Healthy weight. Aim for a healthy BMI. Being significantly underweight or overweight impacts ovulation and fertility for both men and women and affects pregnancy outcomes. Folic acid, non-negotiable. Start taking at least 400 milligrams daily for at least 1 month before trying. It dramatically cuts the risk of serious neural tube defects in the baby. And I like that quote from the community member, Violet Puma. No magic tricks, just enjoy your partner, try not to stress. While there's no magic wand, these foundational steps truly optimize your health, creating the best environment possible.
Okay, foundation laid. Then comes a timing strategy. This is where knowing your cycle really pays off, right? Making sure conditions are optimal for sperm meet egg. Once you know your fertile window, those 3-5 days before ovulation plus ovulation day, the idea is to have sex during that time.
Exactly. And connecting it back, the biological goal is simple. Have healthy sperm waiting when the egg arrives. Those myths about positions or lying down afterwards, they don't really change that biological fact. If you're not sure exactly when your fertile window is, maybe because of irregular cycles, a good strategy is just aiming for sex every other day during the middle 2 weeks of your cycle, roughly days 8 to 20. That keeps a fresh supply of sperm available without making sex feel like a scheduled task every single day. Also, a good tip for the male partner: ejaculating at least once in the days just before the fertile window starts helps ensure the sperm available during the fertile window are healthy and plentiful. Now, let's bust those myths again, definitively. Sex positions. Nope. No scientific evidence that missionary or any other position helps. Sperm are good swimmers. Lying still after. Also, no evidence. Elevating legs doesn't help either. Cervical mucus holds sperm. Millions are released. They get where they need to go quickly, regardless of whether you get up. And one more crucial, often overlooked point: lubricants. Many common ones store-bought, even things like olive oil, can harm sperm or slow them down. If you use lube, ask your doctor for a fertility-friendly one. They're specifically designed not to interfere. Small detail, big potential impact.
That's super practical. And it really highlights the partnership aspect. It's not just about the female side. Male fertility is just as vital. Small changes by the male partner can make a big difference later on.
Absolutely vital to stress that. And what's interesting is the time lag. It takes about 3 months for sperm to fully mature. So lifestyle changes may now pay off in healthier sperm down the road. It emphasizes sustained habits, not quick fixes. Healthy sperm, good shit. Good swimmers have the best shot at fertilization. So for male partners, key actions are: avoid harmful stuff. No tobacco, no recreational drugs, including marijuana. Limit alcohol, max 2 drinks a day if consumed. These affect sperm count, motility, shape, overall health. Healthy weight, balanced diet, fruits, veggies, lean protein, regular exercise, manage stress, good general health, better sperm production. Nutrients. Ensure enough key nutrients like zinc, sperm production, testosterone, folic acid, yes, for men too, healthy sperm development, vitamin C, antioxidant protection. Usually covered by diet, but talk to a doctor about supplements if needed. These consistent habits create the best environment for producing strong, plentiful sperm.
Okay, so you've done the prep, you're timing things, but the big question often looms: how long will this actually take? It can be a source of real anxiety. What's realistic here? Understanding the general timelines might help manage expectations, maybe ease some stress.
It's a very common worry, completely understandable, and it brings up that biological reality of age and fertility again. Desire might stay strong, but biological capacity does change over time. Nobody can predict the exact timeline for any couple. There are just too many factors. But statistics give us a ballpark. About 85% of couples actively trying conceive within the first year. That goes up to over 90% within 2 years. Maternal age is a huge factor here. Female fertility declines naturally, especially accelerating after 35. Why? Mainly egg quality decreases. Eggs aged with us become more prone to chromosomal issues, impacting conception and miscarriage risk. Look at the chances per month. Age 30. Roughly 20% chance each month. Age 40 drops to about 5–10% chance each month. Age 45. Very difficult without fertility help, often needing IVF, maybe donor eggs. And male age matters too, though maybe less dramatically. Sperm quality tends to decline starting in middle age, more noticeably around 50, affecting motility, shape, DNA. Men can father children later, into their 60s, 70s, 80s even, but the odds decrease and risks might increase slightly. Knowing these general age-related timelines helps with planning and knowing when to seek help.
That context is so important. Which brings us to the final point. When do you seek help? When is it time to bring in the experts? Deciding to see a fertility specialist can feel like a big step, but it can be crucial for peace of mind and finding a path forward. Don't hesitate, right?
Absolutely not. Knowing when to seek specialized help is key to optimizing outcomes and getting answers. That REI physician, Dr. Jan, stressed asking for a referral promptly if you're not succeeding, because wait times for specialists can be long. There are pretty clear age-based guidelines. Under 35, see a specialist if you haven't conceived after 1 year of irregular, unprotected intercourse, between 35 and 40. Talk to a specialist after 6 months of trying without success. Time is a more critical factor here due to egg quality decline. Over 40. Consult an OBGYN or specialist as soon as you decide you want to conceive, even before starting to try. Get that baseline assessment early. Also, and this is important, if either partner has a known health issue that could affect fertility, like PCOS, endometriosis, known sperm issues, past pelvic infections, multiple miscarriages, see a specialist before you even start trying. This proactive approach saves valuable time and gets you on the most effective path right from the start, with informed support tailored to your situation.
Wow. What an incredible journey through ovulation and fertility today. We really unpacked a lot, from those subtle body signals to tracking methods to knowing when things might be irregular, and finally when to seek expert help. We really hope this knowledge feels empowering for you, whatever your personal path looks like.
Indeed. Understanding these powerful, often subtle mechanisms of your own body, especially around something as fundamental as ovulation, it really connects you to your own biology and health in a deeper way. It's all about being informed, being patient with the process, and knowing when to trust your body and when maybe it's time to ask for more guidance.
So as we wrap up, here's something to think about. This tiny, usually silent monthly event, releasing just one egg. It's not just biology, is it? It's kind of a testament to this incredibly intricate, resilient, life-affirming design inside all of us. A small miracle happening over and over. What other hidden wonders might your body be trying to tell you every day, just waiting for you to listen? Thank you so much for joining us on this deep dive. Until next time, keep digging deeper.